Hello everyone, I am Dr. Charu Goel Sachdeva. I am the head of Department of Internal Medicine at Manipal Hospital Dwarka. Today I'll be speaking on World Health Day, which is celebrated on 7th April, to emphasize the importance of good health for everyone. Everyone has a right to good health and an access to a healthcare system. For the last 2 years or more, we have been grappling with the devastation caused by the COVID-19 pandemic. This has led to loss of lives. People have lost their near and dear ones. People have lost their jobs. People have left places and have to go to other places to find work. Economy has suffered. The health system has been overwhelmed, and funds have been needed to revamp the health system. During this time, we've also seen the level of inequality. Some people were not even able to access the healthcare system. So we have really gone through a lot at this time. And even after the COVID situation, people are still suffering with the long COVID syndrome, where people are complaining of physical and mental symptoms like tiredness, poor quality of life, depression, and at times even serious situations like a cardiac problem or neurological problem. So this is an ongoing health crisis. Amidst this ongoing health crisis is also the climate crisis, which is going on. So the theme this year is Our Planet, Our Health, which emphasizes the interdependence between good health and a clean environment. So we all know the effects of COVID may be transient, it may go off, but the ongoing climate crisis will have serious effects for the present generation and for the generations to come. Global warming has been going on. There is a depletion of the ozone layer. Direct sunlights have been reaching the earth and leading to warming effects. This has led to unprecedented heat waves, floods in various regions. People have been displaced. A lot of even diseases have increased because of the demographic profile as well as because of the rising temperatures. Storms have increased, and this has also led to increased rainfall, leading to again a crop failure. So all these conditions definitely impact the health in many ways. After the COVID situation, even there's a rise of diseases, respiratory diseases like tuberculosis and other respiratory infective diseases, especially more in people who had COVID-related respiratory infections, pneumonias. So what we have seen is that with the rising temperature, there's a high incidence of respiratory diseases, also pollution, which causes an increase in asthma, respiratory airway diseases, certain cancers also. So amidst the struggle of the health crisis, one cannot ignore the climate crisis that is going on. There is scarcity of fresh water. Industrial waste is put into waters. Fresh water is not available. Waterborne infections are increasing like diarrhea, cholera, tuberculosis. All this impacts the health. At the same time, if we are not careful of our environment, we will see that diseases will be on the rise. So good health has to work along with a good environment. Since last year, various nations have come together to make an initiative to get together to work for a cleaner environment, because we've realized this Mother Earth is a beautiful planet given to us. We cannot deplete its resources. Deforestation, urbanization, all this has not only impacted humans but also animals in many ways. So it is our moral duty to conserve the beautiful earth, not only for us but our future generations also. We can also make individual efforts ourselves, small efforts like trying to save water, proper disposal of waste. All this is very important. Even during the COVID time, there has been increased biomedical waste which has been put into waters, put into the air. We have seen more of a global warming effect, more so in our country which is vastly populated. There's an increased greenhouse effect, more of emissions of these various gases which have led to warming. See, it's a common phrase that when Paris catches a cold, Europe sneezes. Similarly, if a vast country like India suffers from any kind of health crisis or climate crisis, the effects are felt all over the world. So we are all linked. So rather than going in for wars and chemical warfare, it's now time to get together and to focus on the most important part of the life. It's actually time for a universal brotherhood, literally. We have to, just like COVID taught us that no borders are there for the viral infection to spread, and whole world came together to fight the infection. Now is the time to fight the health crisis as well as the ongoing climate crisis. Thank you.